who is Jennifer Lyle. Jennifer is the Chief Executive Officer at SafeCare BC. SafeCare BC has been instrumental in addressing the safety aspects of the pandemic situation in BC for the last few months. So Jennifer, over to you.
Thanks, Habib. And I want to take us all back to January, because in January, we were talking about a lot of things. We were talking about global warming. We were talking about Snowmageddon and the fact that the sky trains were having major issues and we were seeing major backlogs in the stations. We were speculating whether Prince Harry and Meghan Markle were going to move to Vancouver Island. But the one thing that we were not talking about was long-term care, and we should have been. It's interesting because I've been reflecting over this last period. It's about just over a year ago, I was in Ottawa before the House Standing Committee on Health, and I used 3 terms to describe the long-term care sector. This was in the context of violence in long-term care, but those 3 terms were understaffed, under-resourced, and under pressure. And in a lot of ways, those exact 3 themes have come roaring back to the forefront when we talk about this pandemic. And then some new challenges. So when we talk about things like under-resourced, in our work, one of our major challenges that we had to tackle was the issue of PPE. It's interesting to reflect where we started, because back in the beginning half of the year, the entirety of the long-term care sector was not integrated into the provincial pandemic PPE supply. And as early as late January, early February, there were some significant challenges that were coming to the forefront. We saw the collapse of the global supply chain. We saw entire nations engaged in bidding wars over PPE. And we saw the prioritization of the PPE needs of hospitals taking precedence over those of long-term care. What this meant is that by mid-February, 57% of the nonprofit and private long-term care and continuing care providers were already reporting challenges accessing PPE. That turned into 70%, nearly 70% reporting critical shortages of PPE in early April. And it wasn't until mid-April, mid to late April, that we saw the full incorporation of long-term care and assisted living into the provincial pandemic supply chain for PPE. And it wasn't until July that we saw the same integration of home care and community social services sector, both at the federal level and the provincial level. We need to do better. I think in many ways, BC was a leader in that we were some of the earlier adopters of integrating and bringing in aspects of long-term care and assisted living. But even at that point, as a safety association, we ended up taking the extraordinary step of setting up a public PPE drive to bring in 1.2 million donated items of PPE, because there were so many organizations operating without a backstop. And we know the importance of PPE in infection prevention control now. The evidence is clear on that one. The other challenge that we saw, there's a lot of things that I could talk about in terms of under-resourcing, but if I'm going to pick 2, it's going to be outdated infrastructure and staffing shortages. When we talk about outdated infrastructure, it's important to remember that the average age of a care home in BC is over 30 years old. And not only is that challenging from a workplace safety perspective, from an infection prevention control perspective, it's challenging from a quality of life experience as well. Now, there are some good things happening. We saw earlier this week the announcement, and I believe it was the NDP platform announcement around investment in long-term care infrastructure. But it's unfortunate that it takes a pandemic for us to talk about these sorts of things, because again, thinking about what we were talking about in January, the discussion is very different today. I mentioned staffing shortages. One particular initiative, the single site staffing order, which is something that we supported very early on, in about early March, while it was necessary to reduce infection prevention transmission risk, has also further exacerbated the existing staffing shortages we already saw in the sector. Now, again, we see some promising signs. We see the Health Career Access Program that's come to the forefront, but this is a longstanding issue that I know as a safety association, we've been drawing a link to since 2016. So it's something that's incumbent on us to address so that we can be better positioned to care for our seniors and our workforce going forward. And that brings me to my last one around being under pressure. In many ways, we have a hidden pandemic happening at the same time, and that's a mental health pandemic. We have continuing care workers who are reporting anxiety, who are reporting burnout. In a recent survey that we did over the summer, 76% of respondents reported feeling some level of anxiety around COVID-19. We hear anecdotally people reporting fear about being the one to bring COVID into a care home or being the one to bring it home to their loved ones. And we also know that about 10% of those people who responded to that survey indicated they don't plan on sticking around. They plan on leaving the sector. The primary reason cited was due to burnout. So again, here there are some promising practices. We have Care to Speak and Care for Caregivers, which are two mental health initiatives we're supporting with the Canadian Mental Health Association to address this. But this isn't something incumbent on all of us to bring to the forefront. When I think about overall how BC has fared, there are some good things. We've had, and I wouldn't say 156 deaths is ever a good thing, it's 156 too many. But in comparison to Ontario, BC has fared better, where over 1,816 seniors have lost their lives due to COVID-19. But we also need to remember that there were 335 healthcare workers who have been infected by this virus. And we know of one continuing care worker who has died directly because of an infection. So we can do better, we must do better. We owe it to our elders and we owe it to our future selves.
Thank you so much, Jen. I'm looking at some of the questions here. There's one question is, what is your assessment of our PPE situation today?
I think it's definitely better than where we were. And we saw that. So we've done about 4 snapshot surveys over the course of the pandemic. Our most recent one was back on August 11th. And we saw that the numbers had dropped significantly in terms of the percentage of providers reporting critical shortages. So we saw the number go from a high of about 69% down to 17%. Now, I certainly don't want to normalize that. Under normal circumstances, it would be extraordinary that anybody would be looking at that sort of tenuous supply. But it is a positive development. And I do want to give credit where credit is due. I mean, we've seen some pretty significant investments in terms of creating domestic supply chains of PPE. And we have seen ultimately the expansion of federal and provincial efforts to incorporate the entirety of the community and social support services sector into that. So I think we're certainly in a better position than we were back in April. But I also want us to think that this isn't just an issue we're going to see with PPE. At the heart of it, this is an issue of resource scarcity and how you triage. And in a lot of ways, we will likely run into a similar situation when we talk about a COVID-19 vaccine. So I think it's really important that we learn from our earlier experiences and make sure that we are prepared to address those issues of resource scarcity when they come up again, because they will come up again. They'll just have a different face to them.
Thank you, Jen. There's a clarification question. Where were those shortages reported? The 17 personal care homes. You're on mute, Jen.
Sorry, it was 17% of providers. So in those surveys, we surveyed the independent living, assisted living, long-term care, community living, and home care sectors. And so the percentages varied. The sectors that fared the best were long-term care and assisted living in that August survey. And all these survey results are public. We posted them all. The sector that fared the worst was home care. It was at 36%, reporting 3 days or less of PPE, which is how we define critical shortage. Okay. And we're not the only ones who've spoken to this. I know that there's been, our union counterparts have been discussing the challenges that we've seen with regards to PPE. We have heard care providers come out and publicly talk about it. So again, while we're in a better position where we were, we know that this race isn't done. So we need to make sure that we're well positioned to address any of the challenges that come down the pipeline.
Okay, so one more question for you in this round. It's a question about home care companions. So the question goes, it would be great to be able to, or comment or question, it would be great to get the home care companions and caregivers back into the LTC homes and back to the previous clients, thus lightening the load for some of the house staff. So you have any thoughts about that?
Yeah, I echo Dan's comments earlier, and I have a very personal family experience with the challenges and the heartbreak that comes with this. There is a way forward. We know that there's a way forward where we can find a balance between having family members and having personal support workers coming back into care homes. And in some ways there are ways for that to happen now. We have essential visitors, we have the social visitation policy, but there is a way to do it safely and to do it more. And I know when we partnered with Family Caregivers of BC to develop infection prevention control training for family members so they could come into long-term care and assisted living residences with that full knowledge that they needed to be safe. We were very much committed to this idea that family members have an important role to play. And it's not just for the benefit of the resident or the elder in care, but also too for the staff themselves, because it's morally distressing for staff to see elders in their care cut off from their social networks and the people that they love. And quite frankly, it's an increase in workload because of the valuable support those family members and external caregivers provide.
Thank you, Jen. Thank you for the powerful presentation with lots of interesting and helpful insights.